we are right on time. I think it's going to work. We're connecting. Yay!
Hi, guys.
Hi, Krystle. It's so nice to meet you.
I know, we're like virtual friends, right?
I know. I want to give you a hug.
I know.
A virtual hug.
Totally.
Yes. Good. So how is your day going today?
Rockin'. I am so excited, you guys. I am a very visual person. I just have to show you this before we get started. I got all kinds of stuff we're going to be going through. You guys had so many good questions.
Isn't it amazing? I think we might have to have a part 2 and a part 3.
That's what I was thinking. So I kind of organized like into returning to exercise, running, and then going directly at the pelvic floor. So I think should we just do this?
Yeah, let's jump in and we'll cover what we can today, and then we'll reschedule and do another one later. Let's jump in.
Yep. Okay, so postpartum health is such a passion of ours. I went to PT school and we got a choice to do 2 electives, and one of them was women's health, and I was like, I'll take this because I'm gonna have babies someday, hopefully, which I do. Now I have 3. Yeah. And I was like, I did not know all this information existed. Like, if you would have told me in PT school that I would have been like talking about vaginas and sex and all these things, I would have been like, no, like zero interest. But I just feel like it's such a disservice because people aren't getting this information, and literally we don't have the information to make informed decisions on our own body. And being an athlete myself, I just feel like that is so wrong in so many levels. So let's hit up these questions that you guys had.
Yes, let's do it. Okay.
So one of the first questions was, when should we start doing pelvic floor exercises or start exercising? And I would say, honestly, with all my kids, that started day 1, believe it or not. So maybe exercising has a different connotation than, you know, like than a typical person like thinks of. So at 6 weeks, I personally, like, if you're OBGYN, cover your ears, but I personally think the 6-week marker for exercise is like such bologna sausage, because they're really not looking for like big like picture things, and they're not giving people direction. So our job today on this thing is to give you guys some direction on what to do with exercises.
I agree.
So day 1, what we start with is pelvic floor contractions. Believe it or not, you're like, yo, girl, I just pushed a baby out of this vag and you want me to like start, but let me.
It just went like that.
Yes. But so our muscles are pumps, and they pump good nutrients into the area, which reduces inflammation, reduces swelling, which allows for the best healing to happen. So
and the blood flow.
Yes. So I'm not saying to like do a ton of exercises, but just small, short contractions like pelvic floor on, off, on, off, on, off. Same thing with your transverse abdominis muscle. And here's why, you guys. Because our brains don't automatically reconnect with these areas. In foreign countries like France, Germany, they have to go to a physical therapy screen.
Standard.
Yes. It's
standard postpartum.
Yes, that in the US we don't do this, but we're trying to reconnect these areas so that we can do the things that we love. So I'm a runner. I ran in college, so did my sister. If you are a CrossFitter, so that you can return to CrossFit, it's not just about your pelvic floor health and like not peeing when you're like giggling with girlfriends and things like that, but overall general health. And I mean, we could go on a huge soapbox with this, but like just our mental well-being as well. If we're recovering.
Absolutely. One of my favorite things because I had 3 babies too, whenever I was nursing, so that was a great time for me to just remember, okay, let's activate my pelvic floor, right? And doing it with my transverse abdominis. So that was a strategy that worked for me because I felt like I was sitting so much, right?
Totally. So I think if we learn how to isolate it, then we can reintegrate it back into activity. And one thing, I don't know if you feel the same way about this as PTs, but like we get so isolated into, oh, I'm a pelvic floor PT and I'm an orthopedic PT. There's no such thing. So one of the first things that I wanted to go through is that our body is so dynamic. So we need to learn how to control the pressure and then how to work dynamically. So if I'm a mom, I have to be really freaking strong, right? We're carrying around these carriers. We're lifting babies in and out of bed. I'm dealing with a toddler that's thrashing around like a whale in the bathtub. So we have to have upper body strength so that we're not putting pressure downwards on our pelvic floor. Or like a lot of women, when they're like, hey, I'm doing Kegels and I'm just not getting better. Like, let's go through all these questions, because I think a lot of this is like kind of hidden in there.
Good.
So what are some warning signs that we're returning to exercise too early, or we're doing too much too early? So I would say leaking, right? So if we're leaking urine and we're exercising, there's things that we can be doing to strengthen.
Or even poop too.
Yes. Yes. Leaking poop. And then also prolapse. So I do think often people have mild grade prolapses, and you can still do tons of exercises. The problem is people get like a fear around moving or exercising because they don't want to make their prolapse worse. But the big thing is, though, if you don't strengthen, you're actually doing yourself more of a disservice by not doing the exercises or not. You need
that stability.
Totally.
You need that muscle stability.
Yes, yes. Our pelvic floor is a stabilizer too. Like if you, and I think for us, this is like such common knowledge.
Nice.
Like PT, if you think about the body, there's this model called the joint by joint. But so this thoracic spine or your mid back should be a mobile section. Your lumbar spine, your pelvic floor should be stable. Your hips should be mobile. But that being said, a lot of mommies, I find a lot of problems here because they don't have the strength.
To handle that, to handle that mobility.
Totally. So these areas we need to reconnect with so that we can start doing the exercises. The other big telltale sign for my patients in the clinic is if they're complaining like exercise just doesn't feel right, or it doesn't feel fun anymore, or like aches and pains besides being sore, right? So like my hip, every time I go on a run, starts hurting at 3 miles. Okay, like what's wrong? That's not right.
Solve the puzzle.
Kind of backing up and readdressing that. So then I think like let's go back to fundamentals and let's think about what we need to do first, right? So we need to wake up that pelvic floor. We need it to start working with our abdominals and our back muscle to get us out of trouble. So, and it too, again, like the information that you have on your site is like amazing, the feed, because it's so good, and the explanations I feel like so much.
It's such a pleasure.
People can see this. So when your pelvic floor contracts, as we exhale, our pelvic floor naturally contracts. Or too, like toddlers in flu and cold season, as we exhale, so as air comes out of our mouth, pressure is going in one direction. So then the reverse of that is that as we inhale, our pelvic floor relaxes. But, if our pelvic floor is too loose, then that's when you can also see problems and issues. Right. So, if you're leaking with exercise, what's a real problem? So it could be like a stability issue, could be from multiple different areas.
Or even coordination. So they may even have good strength, but just not turning on at the right time.
Exactly. And that's like that whole Julie Weaver thing, the blow before you go. So learning what I just showed you guys, so how you would put that into use is somebody asked you like I'm 2 years out and I still cannot jump rope, but maybe she has a pelvic floor issue, but maybe she hasn't learned how to coordinate her breath with it. So like every time she's jumping, as she jumps,
good,
small short exhales. Or my runners here, if you're like, I'm leaking when I run, and it only happens at 4 miles, maybe is that our threshold, and then our pelvic floor is kind of tuckered out. Or two, when we're running, could we inhale and then exhale every 3 steps, right?
Good. So you have to find a strategy that works for you to turn things on and activate it with activity.
Because I think though, like, do you see this a lot too? Like your patients will be like, oh, my OBGYN told me I had a weak pelvic floor. So then I just hold my pelvic floor the entire time.
And then you've got to have both. You've got to have that lengthening too, right? The pelvic floor needs to contract, needs to lengthen, just like your bicep, just like your hand.
Yes. And I think a lot of things are all about the length tension relationship, right? So like our biceps are not very strong when they're maximally contracted, or they're not very strong all the way down here, but that sweet spot in the middle. And same thing with our pelvic floor. If our pelvic floor is too tight, we can run into problems. If it's just right, obviously that's really good. And then if it's not tight enough, that's where that hammock doesn't create some of that support and exercise for you. So
very good.
Huge problems.
So, everybody, I know you said this, but I just want to back up and talk briefly about the breathing. So when you inhale, so everybody take a deep breath in. And your pelvic floor should activate and release. It's lengthening, and it coordinates with your breathing.
Yes. Yeah. And I think too, like, we're like in this society, we have so much stress and there's things to do and the kids need stuff. So what happens to moms, I think, is we start breathing with our accessory breathing muscles up here. And those things are only supposed to be used like for heavy exercise if you have COPD. So this diaphragm is like the easiest, cheapest drug that we have. So if you think of this sucker as 3 chambers, like a high, middle, and a lower chamber, and that's all right around my bottom ribs, right? Because if we belly breathe too much, I think we're putting too much tension on the belly as well.
Think about the rib expansion, right?
Yes.
Rib expansion.
This is like your gold ring, right? I think of this as my like money maker as far as like really learning your diaphragmatic breath, but filling up that first chamber, second, and third chamber, and then my pelvic floor is relaxed. But it's just like volleyball, you know, if there's any girls on here that play volleyball, like that bump, that spike, if you don't take a good inhalation, you cannot have a good pelvic floor contraction either. So I think we shorten that end of the stick sometimes because we're thinking of, okay, she says when I'm planking, exhale, so I'm not creating too much tension. But same thing with the inhale though, or we'll get into this later because there was questions on having too tight of a pelvic floor. And I think then if you had a tight pelvic floor, I would be hammering that inhalation part to really get that to calm down.
Right. Somebody made a comment on here about the connection. So I want you guys to know that I am screen recording this too. And so I plan to repost this to share the full link. So if it's not a good connection right now, we will share it again. Okay. So I'm sorry. I don't know. Hopefully it resolves.
Yeah, perfect. So then too, when am I able to go back to high impact exercise was a question. And I think this goes back to the basics, right? So we need to have these other small areas awake, but then we also need to be able to control what you want to do. So if that's jumping for you, jumping is a very dynamic thing. So if I have poor hip muscles, my hips turn inward like this, and then they're like trying to create stability out of something that's not supposed to be used as stability. If you want to return to high impact activity, you should be able to land nice and soft. It's like a nice and smooth transition. And I think often that's not what's happening directly postpartum because we're like in such a hurry to lose weight.
Just bam, bam,
yes.
bam, bam, right?
I like just heard this and I literally started using it with everything, but I've like created mantras that I'll like repeat over and over in my head, right? So like for postpartum, I really feel like it should be patience, persistence, consistency, payoff. I love my body. Like I love my body because it's so hard to like be so patient during this time period because it is frustrating, and I think it's okay to be frustrated. But then too, like I get the pleasure of seeing the flip side where people, you know, are so athletic and then they want to like do their normal things too quickly, and then they're paying for it like 10 years later, you know.
Yeah, their body had too much stress and it wasn't ready for it and injured various tissues.
I mean, it scares me because I see them all the time in the clinic. So it's like, I feel like I've been so protective of this time period. But I think often, though, women don't have the information that they need to protect themselves.
Yeah. I want to put a plug in for your program. So basically you have an amazing postpartum program. I was reviewing it this morning. And so if you guys haven't had a chance to look at her guide, it's, I think, 236 pages, and it goes through a great information, but then it also goes week by week with the different different muscle groups, what you should be doing. And this is a guide, okay? So everyone can, everyone may be different. It's not one size fits all, but it gives you some framework of some safe exercises and a lot of really helpful tips. And I also loved the personal side of things that you guys put in there. I thought that was a really, really nice touch because it helps you to connect. These aren't just people telling me what to do. They've experienced it. They have a personal understanding and a professional understanding. So check it out. And we can talk more about that as well, but I wanted to just put that plug in there because even listening to us right now, we're giving answers, we're saying things, but it's overwhelming. I think if you've just had a baby, you're not sure where to start. So yes, we believe that you can get to the point where you can do high impact and that you can run again, but there's a lot of steps that have to happen beforehand. And your guide gives you some great framework.
In my opinion, like the perfect marriage is a PT visit plus the guide, because I think the guide, I mean, I didn't even know how to do everything until I literally sat down for over a year, and my sister and I wrote everything out, because it really is
how much time that took.
rehabbing some of these injuries, right? So we know with postpartum, low back pain is a huge problem, upper back burning, neck pain, headaches,
because you're always leaning forward.
Yes. So that stuff's actually in the guide, written body part by body part. And then it's kind of getting your kids to eat vegetables, right? Because we're doing our rehab, but we actually just think we're getting a kick-ass workout.
So I didn't realize that was your sister.
Yes. Yeah, that's my sister.
I love it.
Who do you think's older?
How could you possibly ask me that? No way I'm answering that. You tell me.
I'm just kidding. I'm the older, wiser one.
You both look amazing.
And then too, anybody, and I'll give you this code to share on your feed if you want, but anybody that's listening from your listeners too, we did set up a code only till Thursday for 20% off, but that's pelvic floor muscles is a code. So pelvic floor muscles.
Pelvic floor muscles. That's the code. So you can go to your Instagram page at Expecting and Empowered, or you could go to your website. You have a link there on your bio.
Yeah. And then plug in that code, pelvic floor muscles, and that will give you 20% off.
Awesome. Thank you. That's great.
Of course. I mean, we're just trying to help as many people as we can. So then let's get back to some of these questions. So planks too. Planks is a big question, as far as core things. So whether to do them or not to do them. I'm a huge believer that any exercise you can probably do if you know what you're looking for and know how to control it, right?
Exactly. If you're activating the right muscles and you're doing it correctly.
I don't think anything's off the table. So let's go through what I'm looking for when somebody is doing a plank, and then maybe Natalie, if you just want to record them. And then what you want to do to activate your deep core. So sorry, Natalie's just going to help me here.
Oh, good. Hi, Natalie.
So with a plank, right, I'm going to show you how to do your transverse abdominis. So we have these muscles, right? The transverse abdominis goes corset. It's the deepest muscle. Have you been checking out the birth? Diane Lee, she shared this tidbit where they were doing research, and the fibers, just like a Chinese finger, from the transverse abdominis, they interdigitate. Yes, they interdigitate. So if we have this transverse abdominis, also helps women close that gap or strengthen that area for DR women. So you have that split in your abdominal. So the best cueing that I've heard somebody use so far was her on that, where she says to act like there's a string connected to one side of your hip and the other side of your hip. Try drawing that wire together and then zipping it up this way like a tight pair of pants. See how my abdominals flatten then, and then everything goes nice and firm. So I also can check this during exercise, right? So if I use my finger 1 inch in, 1 inch down, this is the only area where only the transverse abdominis is there. Otherwise, there's other muscles that overlap that, so it's hard to tell. But again, here, connect the wire, draw up and in, right?
Good.
So then, this was another question on here as well. We'll get back to planking, but what should be my first exercises for my core? So, and that are safe for my pelvic floor. So I learned how to control my transverse abdominis. An exercise could just simply be the contraction of that. Hold it for about 5 seconds and then relaxing. Another contraction could be, all right, my transverse is on, then I'm going to march because I want to eventually walk to run. So that I'm learning how to control that and hold that on.
Right. You don't want to see the pelvis tilting. You want that core to be stable, and basically these muscles, the transverse, are keeping the pelvis and the low back in the same position. It's only the legs that are moving. So if you're seeing your pelvis or back moving around, you're not doing it correctly, or you're not strong enough for that much movement.
Yes. Just back it up to the basics. You know what? Base hits win baseball games, right, ladies? So you don't have to be doing like the crazy leg tap side to side to win baseball games to get your abs back right away. No. So let's do the fundamentals first. So then too, you can add like just the sliding. They're called heel slides, but I'm making sure this stays nice and taut while I do that. What we're not looking for, so this exercise and the planks included, and I've practiced this, so I'm really good at it now, but is that like coning, right? The coning happens because my rectus abdominis is contracting. So the rectus is a small, skinny muscle, and then it creates like kind of that tensioning, just like a tennis court. Yeah. So then my muscles bulge out like this, and then I'm not activating my deep stuff. That also would encourage that splitting of that linea alba, or more tension on a muscle that really should be used for that. That's just a front loaded. So that being said, that may create too much tension on there. So then, try to go back to that transverse abdominis contraction and do the simple things. Yep. So planking, not out. Right. Core planking, out if you can't control that. And you'll see that belly sag. If I'm up in a plank, I can hold that contraction nice and tight. But if you start to see that sag or the coning happen, that's when it's out. Planking versus planking too, like with moving your legs or your arms, that's a lot harder, right? Because then you're
any kind of movement added. Yeah.
Trying to add that movement in, and that's really hard because basically I'm like trying to teach your body how to wing shift. We see women often like postpartum too. Look at my sweet little baby. So I'm holding my sweet little baby, and then I'm always holding him to the side, but
always adapting
your pelvic floor. So when you're trying to line things up, what I want to try to do is keep everything stacked like appropriately so that my abdominals and my pelvic floor are in an advantageous position. So to do that, if you think about the top of your head, I'm creating space in my spine.
I'm sitting up taller now.
So all my yogis are at, you're creating space in the spine. Then I love this like cowabunga symbol, like hang 10 dudes, but I take my thumb and I take my pinky, and then I'm trying to figure out how to stack my ribs back on top of my hips. So this applies to everything. Sitting, watching Game of Thrones, running, right? This is a personal story, but I was having crazy sciatica down this leg when I was running. I learned this when I first learned this about how to like stack our hips or our ribs over our pelvis. Sciatica gone during running. Like that's pretty powerful stuff, right? That's crazy. And the reason that this works, you guys, is because our pelvic floor and our diaphragm, again, if we go back to that canister thing, are the strongest when we have them stacked appropriately. But when we start doing things that take them out of that stacking position, so I'm holding my baby here or I'm nursing here, do you see now how my ribs are way far in front of me and my pelvis is back here? So then I'm at the gym too and I'm squatting, and look at how much my little butt has to, like, it's called anal winking or butt winking. My butt is winking. That creates shear force on my low back. So this transitions to holding babies, working out, sitting and being lazy. But if I stack those up, crazy different, crazy strength difference.
So applying these things to every activity and everything that you're doing in your life. So many times we're busy, we're doing so many things. Just backing up, thinking about, okay, what posture am I in? How am I breathing? What is this doing to my pelvic floor? And other muscles too, but specifically right now we're looking at pelvic floor. So,
yes, but this could totally be the runner that was asking us, hey, like, how come all of a sudden, like, some days I go on a run, don't leak, and some days I do? What if that mom literally had like a crazy rough morning and she's here and like now her pelvic floor can't engage because everything's not stacked up, right?
Yeah, right.
So, like, there's reasons behind these crazy patterns that our bodies do.
Good. Very good.
Yes.
Excellent.
Yes. Okay. So, how come I'm 15 months postpartum, still not back to fitness mode? I think a lot of that goes back to the basics that we've been talking about. So, our deep hip rotators. Our hip is a ball and socket joint. When we're doing fitness activities, though, often I see a lot of movement this direction. You know, squats, lunges are all this direction, but our hip doesn't work that way or only that way. We want to be adding things that challenge the hip. So resistance bands around your ankle, walking with your core nice and stable, you know, monster walks where I'm putting that resistance band around my ankle, going forward, backward.
Good.
Also, our mechanics change while we're pregnant, right? So that weight comes on. My calves have to hold up a heck of a lot of weight going forward. My quads and my butt muscles.
Yeah.
So tight ankles, man. This is a secret sauce here.
Okay.
This stuff's in the guide.
I love it.
Tight ankles are a huge problem to returning postpartum. So let me give you two different things that you can do. So at home, if you have a stair or you just take a little 2x4 like that, but start jam it, like, so you're trying to bring your knee over the toe, and I'm trying to keep my heel back there, but I'm creating what's called dorsiflexion, so that when I'm in a squat, I can go down deep in, mine's horrible, sorry, but I can go down deep in the squat, so that I can, like, start to get that movement back, so then there's not as much pressure on my low back. Or two, do you guys walk? Just regularly walking, because if I don't have the dorsiflexion, I cannot let my leg come behind me like this. And then I'm like literally dragging everything forward with my hip flexor, right?
Are you improving that mobility?
A nice smooth horse? Or are you like those Clydesdales, like dragging your foot forward, right? But that totally start at the ankle. And I think it often does.
Yeah.
Let me show you this too. I love this one. This one you'll see in the guide as well. But so weight goes behind you. I like to load it up, right? I'm an athlete, so I like to do everything excessively. No, just you should be using the heavy weight. But foot is forward in the front. What I'm trying to do is drive my knee again over my toe and then squeeze my nice little round tush coming back up, go over that toe, and then squeeze everything. So what I'm trying to do is create flexion moments and then trying to use my extensors to come back so that I'm actually functionally training the muscles the way they should.
And that's a good exercise. You're getting some good glute work there, and you're getting some good dorsiflexion mobility, and it's not putting excessive pressure on your pelvic floor if you're breathing and you're activating and engaged, and correct posture. I mean, there's so many elements, right?
Totally. I stole that from an NFL PT. You know, he didn't know much about manual therapy. I taught him a few things, but he did sure know some things about exercises.
Nice. That's cool. That's good. I love all your demonstrations. This really makes it very relevant. Thank you for taking the time to get all the props and do
Oh yeah, I'm a visual learner, so I feel you girls that are visual learners.
Yep.
Okay, so then too, how do we know to increase the intensity, the weight, the impact in a safe way to protect our pelvic floor? So again, I'm looking for those like tall signs. Like, do you feel heaviness in your pelvic floor? I think this is a sign that often gets overlooked with exercise. Like all of a sudden you kind of feel like a softball-y type feeling, or intercourse feels like there's like something there that wasn't there before. You know, so this like heaviness in the pelvic floor, maybe you're progressing too quickly. Because one of the things that I think people are most at risk for postpartum that they don't realize is this prolapse. So what prolapse means is that the organs in our body, so the uterus, the rectum, and the bladder can all of a sudden start coming out. And if you guys follow this feed, you know this because some of the illustrations are awesome on here. But when that stuff starts coming out, that's what that heaviness feels like. And people don't know quite what's going on. They just know that things aren't right down there, but that can happen significantly in postpartum when we're returning to things too quickly. So as an athlete, again, I think sometimes we have to take our athleticism, if this is athleticism, and put it on the shelf, you know, like we got to put our ego, like I'm a runner that can run under 7-minute miles, but do you think that's appropriate right away postpartum? I've done the least amount of running, I'll say, since 2015, and like I don't know, since I've been 3. Like, it's so crazy. I, like, cannot believe, like, and, you know, that wasn't an easy transition for me. I literally would see people running, and I'm like, ugh. I mean, I don't think I can say the words on here, but I was like, this is not fair. Because I thought that I was going to be, like, the person that ran until, like, 38 weeks and had a super cute little bump. And I had such like horrible pubic symphysis pain with my first. I like would get out of the shower and I like couldn't even walk straight. And my husband's like, yo, when are you gonna stop running? And that's like when the PT side, I guess, wasn't clicking on, but I was like, I'm not. But the second 2 pregnancies though, just followed the guide, ran until when I felt comfortable, then backed it off. But, you know, with that, it's nice because in the postpartum guide in the very beginning, we talk about like how long you can walk in the very initial stages. Because I think that's very helpful to somebody like me that can't control themselves. I have no self-control with food either sometimes. I just had a burger for lunch. But with this lays out like walking 3 minutes, rest for 2, walking 3 minutes, repeat.
Yeah.
Because I do think too, the flip side is people need it on the other side too, that like are like, I don't want to do anything. I don't want to do anything. But this expedites the healing.
Yes. And it gives you some framework. Again, that's not everyone, it's not as rule set in stone that you have to follow it exactly, but it gives you some framework. So tell me, when did you return to running after babies?
I honestly don't even mess around with my health is so important to me, and I know I want to be running like for a long time. So I don't even think about it until I'm 12 weeks postpartum. I do a lot of homework before I can do that. And actually too, like on our blog post, I put this really nice, simple testing screen. So you have to have running is such a dynamic sport, you guys. You need a lot of control to do this. So as I'm running, I need to be able to do single leg movement, right? If you can't stand on one leg, you've got no business running, right?
Yeah, exactly.
I need to be able to stand on one leg. I need to be able to control my hip control outwardly so that I can create some pressure or tone. So that, because if I don't do that, what happens is my knee caves inward, my pelvic floor goes this way, and I'm tightening my pelvic floor, my hip muscles keep getting tight.
Yeah.
Because your body is so smart, it will try to create stability. So what happens is like, that's a runner that has like an angry piriformis that they foam roll and they stretch and nothing's happening. Your body needs stability somewhere, right? So we have to have abdominal strength. You have to have hip stability. So if I lay it on my side and then I have somebody come beside me and my hip, knee, ankle is in one line, if they push down, they should be able to push me down. You know, this is an isolated strength test, but it's nice for running to give you some parameters. If my leg's out in front like this, they push down, again, should be like rock solid, that thing's not moving, right? So then you know that's a couple things that you have business running. If I take a 2x4, this actually isn't a 2x4, or I just measure 4 inches away from the wall, put that little guy on the wall, I should be able to drive my knee all the way to the wall without lifting my heel. That means that I have good enough ankle range of motion to get at it. Then too, I should be able to rise up on my calf like 10, 20 times, like on its own. Again, like just on one leg, right? People are like, what? But that's essentially what we're doing running.
Yeah.
Then RDLs. So I should be able to, and I like to use, we'll just use the baby, but I like to use a target. So for these, single leg RDLs, if I put this little baby down, sorry, I run out of room here, but if I put this little baby down and then pick it back up, I should be able to do 10 of these without losing, without losing my balance.
I didn't see it.
Oh, yeah. Without losing my balance. So there's things that need to happen, because otherwise you're the person that has SI, low back pain, you're still leaking, you still could have pubic symphysis problems far into the postpartum period. You know, your DR is not healing. You have a prolapse grade 2, grade 3, grade 4. Grade 3 and 4, my personal suggestion is I wouldn't be running until we've got that down.
Yeah,
until it's healed a little bit. Or even with the lighter prolapses, I would be using something to support it. So like with all my exercises directly postpartum, I'll just show these, but these are the Bay compression. Are you familiar?
I've seen them. I haven't felt them.
These are, I don't mess
to.
around. I do not cheat on Bay. I've tried all these competitors, and so these just general exercise I'm talking right now are very helpful. Like I wore these the other day running, because there is so much compression, but it's not too much, because we still want our own muscles to be able to do it. So
those
it's
are the postpartum ones?
These are the postpartum leggings, yep. And it's fake it till you make it. The other thing, if you did have a prolapse, a pessary might be something that you get fitted for, and or to, I've had patients use that V2. So
yeah, I like the some external support there.
Yes. So specifically for prolapse, the pessaries, the V2s, but in general, like if you don't have a prolapse, these I've used now like the last 2 pregnancies, very, very helpful. Too, they're so nice because they come up high, so nobody has to see my side view.
Nice contours. Have you used the EVB Sports? So they have a brief and they have a running short, and it has built-in perineal support. I got a pair a week or 2 ago, and the lift that it gave me externally felt really, really good. So that's another option for some external support.
Ooh, I love that. I'll look those up.
Yeah, and I'll send you the link, and I'll post it. I don't know where I'll post it. I'll post it on the story, and I know that I'll be doing a post on the shorts too, because I thought it was a really nice option. So
yeah,
good. All right, where are we in our questions? The tailbone.
The tailbone we could talk about, but my personal thought on the tailbone is check out a good PT, and my thought too is you have a directory on your thing, I saw.
Yeah. We have links to 4, because there's so many pelvic health directories, right? So on our website, mypfm.com, we have links to all 4 directories. Some are more US-based pelvic health therapists, and then some are more global. But
yeah. One thing too that I like to tell people that I'm not near is saying call. PTs are very friendly people. And hopefully their office staff are too. But call and be like, hey, this is what I'm dealing with. Does your pelvic floor health PT do this? Have they dealt with it? Because tailbone issues, so there's a lot of things going on during labor and delivery, but a PT can literally, and I know this sounds absurd to people, but indirectly, I can get right to the tailbone, pull that guy out, wiggle her around a little bit where it needs to be, teach you how to relax your pelvic floor, bada boom, bada bing.
Yeah. I mean, if if you think about how much a tailbone affects your life, it's worth it. It's not that bad. And I put it into perspective too. Think about the biggest bowel movement that you've had. Okay. My finger is smaller than that. So just relax. We give you some tips to let go, and it's not that bad.
It really, and it's really not that bad. And like, I feel like PTs, like, we're so passionate about this. I mean, on people, like, this is often, maybe, would you agree, like a 2-visit fix? Like, right. So you're not right. with us very long. Yeah, so
it can be
you don't
really,
even have
really
to wait
fast.
to Target if you see us. Yep. We can act like it didn't happen. But it's life-changing because you can sit down and enjoy Easter dinner then with your family, right?
Exactly. Other than that, you're taking your cushion with you wherever you go, you know, or your boppy. When I had my first baby, it was close to 8 weeks that I was sitting on my boppy. I couldn't sit regular. It was so painful. So don't do that. Get help.
Yes.
There is help.
Yes.
And if you have difficulty finding a pelvic health therapist, I want to help you. So wherever you are in the world, if you can't find one, I can't guarantee that I can find one for you, but I'll do whatever I can and help connect you.
Yeah, perfect. And then I think too, like, just following up on the tight pelvic floor or the tailbone stuff, almost goes in the same lines as tight pelvic floor. So there was a lot of questions like, how do I return to exercise if I have a tight pelvic floor, or what are some exercises to do? And I really like this question because I think this happens more often than we would like to think. So
it can be weak and tight.
Yeah.
People think, oh, I'm tight. That's a good thing.
Since it's tight, that's a good thing. No. And two, some signs if you don't know, like if you were like, well, I don't know if my vag is loose or whatever, like if you're having pain with intercourse, so either with insertion and or thrusting, and if you're having pain putting in a tampon, or even sometimes just pain sitting, like on your sits bones, these would be signs. So I personally like having a PT stretch mine out, but we can talk about what to do and the stretches to do for that.
A couple other signs of a tight pelvic floor too, or overactive pelvic floor, would be difficulty with urination. So if you're having to strain, that could be a pelvic floor issue. It could also be maybe a kink in the urethra where the prolapse, the bladder is kind of falling down. And then also constipation. So if you're really straining and having difficulty, that can be another sign of an overactive pelvic floor.
Yes, totally. So then we talked about this. We won't go over it again, but the inhalation. So when you're in these exercises, you're taking inhales. So if I were to actually lay on my side, I'll just keep standing. But what you can do is you can side, and I can actually put my hand in my butt crack, and then I'm trying to pull like my sits bones away. So if this was me laying on my side, I'd sneak my hand here. See how my pelvic floor attaches here? I'm lifting this, giving this side a nice little stretch. Then I could flip over to the other side. Again, my hands in my butt crack. And then I'm grabbing the bone on the inside, lifting up and giving it a nice stretch. The other ones that I also like too are like grabbing inside a sink or a counter and then just sitting back. So like I'm sitting back down, like really, really in a deep squat and working on my inhales there. I like that. You could also do the same thing sitting on a yoga block and just kind of letting that all stretch out, if that makes sense.
Very good.
So to like, so that's one thing. The other thing to think about if you had a tight pelvic floor is like, why does that want to be tight? Are you not using your transverse abdominis? Do you have like weak hip rotators? Because our hips are actually part of our pelvic floor. So if we are like not strong in the hips, that pelvic floor has to tighten and create some stability. Yeah.
So if you're lacking stability somewhere, it's going to try to make up for it in another area.
Totally. Also, best exercises for urgency incontinence. So urgency incontinence is like when you get home and all of a sudden you put your key in the door or your garage goes up and you're like, yo, like gotta go to the bathroom, and you can barely get your clothes off before you're tinkling your pants. So that's what urgency incontinence is. I think that it happens more often to people than we would like to believe because we start to ignore bodies. You guys, I just did you see that? I just did like a series last week on this.
I didn't see it.
Oh my God. I mean, I always crack myself up, but that series is really good if you have urgency incontinence because it like hits everything you need to have this without taking up too much time to fix it. Go to our Expecting and Empowered and go on our highlights. Okay. And it will show you right there how to fix a lot of it. Is it
called urgency, or what is the highlight called?
Yeah, it's called urgency incontinence. Okay. But it's like fun because it happens. And the only thing that I probably would have done a little bit different, like if you're a person that pees every 30 minutes, like, you know, I put a timer back and then I'm trying to get myself back up 10 hours. So normal urination every 2 to 4 hours. So then I can set a timer where I'm like trying to get back up to that. Or the flip side, and probably how you land in this mess during the day, like you're a nurse or a teacher and you never took a break to pee during the day. Every 2 hours you're setting a timer at work, and you're going to the toilet whether you need to or not, and just trying to sit down and get the bladder back to a normal size. So that was a great question. You got to check that out if you have that on our feed.
And off too, so you guys can just click on the link.
Yes. Okay. And then I know this is a postpartum thing, but we did get asked questions about pregnancy. So the best things to do before pregnancy to reduce pelvic floor issues. I love this. I'm like a preventative gal at heart. I would like love everybody to get this information.
Yes.
As your baby grows, of course your abdominals are expanding, right? But in that third trimester, these little stinkers start sinking south, and that they're supposed to, right? They're dropping. They're getting ready to come to the world. Lengthens or puts pressure on our pelvic floor. And I think during pregnancy, a bit of pressure, normal. A ton of pressure in that area all the time, not normal. Then we're not supporting this area enough. So you got to learn how to work it, right? During pregnancy, so you got to learn how to do your pelvic floor contractions. We also have to learn how to relax it. And then we have to figure out the in-between steps, right? These in the guide are called elevator kegels. But okay, when I'm lifting up my little Camden's a bad example because he's like a huge baby. But when I'm lifting up my baby, anyone, and like then I might only have to contract my, not like a all or nothing thing. Right. It's like, okay, exhale, lift baby, small. Exhale, lift baby. And the more that we practice it, so like you, while you were nursing and you were having, the more it becomes automated, right?
Exactly. Because that's what we.
Yes. And then when I go to lift my 75% contraction because they're squirming, they're heavier. So I need to like learn these steps, and then again to let go all the time, because I do find some moms, you know, like when the stress is high, we hold stress in our pelvic floor too. So maybe your baby's crying and you squeeze that sucker on tight, like letting go of this area so that we can have a nice strong contraction.
And so just kind of tagging onto that, our body has the ability to learn. We have motor learning. So you know if you're going to pick up a feather, so you're picking up that feather, but your body knows how many muscle fibers to engage, right? Versus a brick. Okay, so we're still using our hand, but we are engaged picking up that brick. So practicing, like you're saying, before the activity, so that during the activity, your body already knows. And you won't know automatically what to do, and that's neuromuscular retraining with activity and with function.
I love that. I'm going to steal it.
Yes.
And then, so during pregnancy, the first trimester, I would be hitting those abdominals because they're about to get stretched to smithereens, right? Yeah. So if all is well, I'm beefing up this section that's about to get obliterated, literally. And then during
so we have multiple muscles that make up the abdominals.
Because too, don't you think during GR what ends up happening more often is that actually we're trying to gain stability because the baby is expanding, right? So this is stretched out no matter what. But then my obliques are, and there's all these trigger points in these obliques. Guess what though, ladies? The obliques attach onto the sides of the rectus abdominis. So it's like a book. They're like pulling them apart. So one of the things that I found is like the guide's great to help with the healing of the DR, the basics, but getting a skilled PT to get in there and get the trigger points out could be like the very first.
I love it.
Or the very last step, into like helping heal that DR. Yeah. Because I think those get more work done, like they're period, and they never get lengthened out. Yeah. Mm-hmm. For suggestions during pregnancy, and then too at the very end, one thing I think that we need to start thinking about is like that feeling of relaxing our pelvic floor. So almost like that.
I know that we're nearing the end of the Instagram limit. So if for some reason it cuts off, like I think we have about 8 more minutes.
Perfect.
Yep.
So learning how to bulge, and then also to either seeing they can help stretch out that backside of the pelvic floors, because what those tears, right? Mm-hmm. So whether those are natural tears or episiotomies, they're tearing. So the PT can go in there and kind of help get you, I think really, because the research goes back and forth on this, but I think the most beneficial thing is mentally preparing, like getting used to that uncomfortable stretch feeling. So you know what's about to come during labor and delivery.
Exactly, because we need those muscles to release, to allow that baby to come out. Engaged, we're working against labor. So I agree. I think I also advocate individuals that are pregnant actually starting perineal massage around 35 weeks, but always check with your provider. Tutorials as well, like a little video that you can learn how to do it, because I think it's wonderful to have a PT do it, but you also want to be able to.
Yes, I teach the same stuff. And then so too, strengthening with an actual tear. So if we do, and they are kind of natural. I mean, if you think about what's coming out of that area, even it happens to even the best pelvic floors. So if that does happen too, one thing that we're talking about when you have pain with, like this isn't the best color, sorry, those tears usually happen around these areas, here. So then having like you or yourself after it's healed. So what do you tell your patients about 6 weeks?
Only 6 weeks. I mean, I like for their women's health provider to clear them for it, but certainly certainly discuss it at your 6 weeks, and hopefully at that point you're healed and you're ready to resume intercourse. An easy tool to say, okay, once you're cleared to resume intercourse, you're probably safe to do it.
Yeah, because I think just being able yourself to get in there, pinch I like this move too, but I call it the key hold, where you push down. So I'm putting pressure and then twisting. And then so if I twist to the left, is that tight? Or if I actually twist to the right, is that like really tight?
Yeah, I like it. it's meant to move. If we don't move, then those muscles that are underlying it are going to get tight, and we need mobility.
Great, right? So like you only see 10% of the scar tissue on top, 90% of it down below. So same thing, because I had C-sections. So same thing with the C-section scar. We're working on two different things. We're working on the scar mobility and desensitization with C-section. So C-sections, they cut the cutaneous nerves. Those are nerves that innervate our skin that give us sensation. So these are the women that don't like to put a pair of jeans on because it hurts, or your toddler steps on your like cannot handle the pressure or the sensation of something rubbing against it, or your husband touches there and it's like sets you through the roof. Lots of help. So whether it's a PT or you doing it on yourself, let me just see.
And it can have an amazingly,
Yeah. So those C-sections, if this one is my C-section scar right here, what you can do already, like right preventative wise, is take different textures. So I got like canvas here, I have sand. Make yourself a little kit. You could honestly take cloth from your house, and then you're rubbing it around the area if you're a fresh C-section, right? I'm not going to area heal for about 4 to 6 weeks before I start going over it. And then what you're trying to do is you're trying will regrow, right? If we like draw your brain and draw attention to it. So you're trying to draw awareness. So then I take my different textures, and then I can start going closer to the scar. And then like eventually at 4 to 6 weeks over the directions to expedite that healing.
Yes, yes, yes. That's good. That's good. Do you think we have time for one more?
Sure, let's do it.
If we don't, if we get cut off, I just want to say thank you so much. It's been an amazing hour with you. I look forward to doing it again. And
oh my God. Well, you as well. I think too, how about let's just, because we did talk about running, let's just like leave with this too, is that study out of the University of Wisconsin. I don't know if you saw that was 1 year postpartum, had altered running strides like 1 year. So what that means though is that people are predisposed to back pain, high hamstring, piriformis injuries, because our body is not able to absorb the shock. So if our pelvic floors are like postpartum period lasts forever, right?
Yeah.
So we've talked about the beginning, the middle, and like the end. On Instagram, she just sent a message yesterday, but she said, 3 years postpartum, I have not like felt normal with running. So basically she went back to the basics, and then she's running pain-free. So I just think like too, I think we think in our heads, I had my baby a year ago, good to go. I just think there's so many women that are still having problems 5 years, 10 years.
We've got to go and build.
Yeah.
So
yeah.
I totally agree. Well, everybody to check out the guides. I'll also post a link on my story for that. Thank you for taking all the time that you've done to create those, because I can't time and love and energy you put into that. So thank you to you and your sister as well. Thank you for your time today, and I look forward to continuing to share.
Yes. Bye guys. Have a